Through the Johnson Opportunity Grant, I was able to intern this past June with the International Children's Heart Foundation, or ICHF. ICHF works around the world to develop pediatric cardiology programs. I traveled with an international team of pediatric surgeons, cardiologists, intensivists, PICU nurses, and respiratory therapists to Guayaquil, Ecuador. ICHF has been working in Guayaquil for about 2 years and comes every 3 months for 2-week missions. During this period, they work with local staff to train surgeons, physicians, and nurses in the field of pediatric cardiothoracic surgery and pediatric cardiology. This internship provided a unique opportunity to observe in 3 fields related to treating children's heart defects: diagnosis, surgery, and recovery. During my days with the cardiologists, I learned about many of the different heart defects and learned some of the basics of reading a heart echo. In the operating room, the surgeons explained a variety of different open heart procedures and even let me scrub in to see the heart up close. In the pediatric ICU, I learned about the post-operative care for our patients. I learned so much more during the mission trip than I could have over a similar amount of time in the U.S. During a typical day, I would be in the hospital from 8 in the morning to at least 8 or 9 that night. On many of the days, I would commit myself to one patient, looking at their echoes before the surgery, observing the surgery, and following them to the ICU afterwards. I would help whenever possible and offer up my language skills, but ultimately I was there to learn, and I learned so much more than I could have ever hoped for. I have always dreamed of becoming a doctor, and I hope to work in missions both abroad and domestically. I was able to intern with an organization that is different from many other international volunteer programs, and that it works to help in both the short term and the long term. During each mission, the cardiologists diagnose children and the surgeons operate on the most serious cases. However, they also work closely with local doctors and nurses to train them to diagnose and to perform future surgeries. The most challenging issues for the organization are their limited time and resources. ICHF is run by volunteers, and due to limited funding, it can only go to each location a few times each year. This makes developing the local pediatric cardiology program a very slow process, but it is extremely necessary. Pediatric cardiology and pediatric cardiothoracic surgery are very specialized fields of medicine, and many nations have not yet developed adequate programs, which is the case in Ecuador. Families occasionally pay to have the surgeries abroad, but for most this is not an option. The cardiologists saw hundreds of children that need surgery, but the surgeons only have enough time and resources to operate on a few dozen during each mission. In the U.S., these children could undergo surgery at an early age, and many would be able to live relatively healthy lives afterwards. In Guayaquil, we saw numerous older children that had been living with heart defects throughout their entire life and had a poor quality of life because of that. Luckily, ICHF is committed to addressing their needs and helping local doctors to address those needs in the future. This internship was an extremely valuable and rewarding experience. I saw many different aspects of medicine as well as the challenges of being a doctor. I am now more committed than ever to pursuing a career in medicine and mission work. Thank you so much for giving me this incredible opportunity.